As today the topic is how can we take precautions in case if we have high fever. And last week we know there was one tragedy. One of our students, he passed away. And may Allah subhanahu wa ta'ala give him the best place in Jannah. And may Allah subhanahu wa ta'ala give tawfiq to the family for sabr, for patience.
Ameen.
And so today is very small session, and I will be basically having an interaction with you. We'll asking you some question, and then we will inshallah will go forward. So the fever, having a fever is a normal response of our body. And any one of you know what is the normal temperature of our body? 98.6, yeah, very good. So it can be measured in two different scales. Some hospitals, they go with the Fahrenheit, and others will go with the Celsius system, which is a centigrade, okay? So 98.6 or 37 centigrade is a normal body temperature. The body temperature can go 1 degree up or 1 degree down during our daily activities, which is completely normal for a normal person. And sometimes people can have a little higher temperature, or maybe like a 99 or just below 100 Fahrenheit. And this temperature, if it stays for a longer period of time, then definitely we should be concerned about it, that something is going on. So having a persistent fever, even if it's less than 100 or is close to 99, it tells you that there is something going on with your body. So what kind of the things can change our body temperature? Do you know that? Yeah, that's a very normal thing. If you do exercise, walking, that can go, the temperature can go up for only for a short period of time. But if you have persistent, like a fever, and it means your body has been basically invaded with something, some kind of bacteria or viruses, or you have some infection. So your body is basically responding with high temperature. And actually, this is a normal defense mechanism of the body, because our body, it works very well with a little higher temperature, basically to fight off that infection. And in that situation, if you have a low-grade fever, what do you think what you should do at that point? Yeah. Actually, you should actually, first of all, let me ask you one thing. How do you check your temperature? Do you know the thermometer? Right? Yeah, thermometer. So if you have like little babies, 4 or under, in those babies, it's very difficult actually to check the oral. You can check the temperature orally, or you check the temperature in the armpit or axilla. And usually, the armpit temperature is usually 1 degree lower than the oral temperature. So in little babies, usually it's very difficult to take the oral temperature or the temperature. Then you can take the temperature in the armpit, or sometime in the little babies, they do the rectal temperature also. So if somebody has temperature like a 99, or close to 100, and it's a persistent temperature, the first thing we should basically try some over-the-counter medication, which is like a Tylenol or ibuprofen or Advil. And if the temperature, it doesn't respond, or the temperature is going up, then definitely there is an infection which needs some attention and more investigation. So, as I said, there are some infections like a bacterial infection, there are so many viruses outside, and some of the, the parasites, they can cause, the infection. And some of those infections can be very, very serious. And we say somebody is having like a 103 or 104 temperature, which is basically a high grade temperature. What is that? You can't come to the school. Yeah, that you're right. Yeah, if you have a high fever, you can't come to the school. So if somebody is having temperature 103 or 104, it's a high grade temperature. At this point, definitely, an investigation by a doctor is very important, because some of these infections can be very, very serious and can be life-threatening also. Like, what are those infections? Do you know that? Sometimes people can have a chest infection, okay, the main infection, which are very common, or sometimes like a brain infection, we call it meningitis or encephalitis, those infections. And those infections can be very, very serious and life-threatening infections. So in that situation, definitely going to the doctor or consulting your doctor for further treatment is very, very important, because some of these infections may not give you enough time, or at that situation, over-the-counter medication may not be very helpful. So there are certain precautions actually which you can take, which can prevent you from getting infection. Any one of you know what are those precautions? Making a dua. Right, yeah, first thing, always Allah subhanahu wa ta'ala to keep you healthy and, give you shifa and prevent you from medical, the problems. Frequent hand washing. Anytime when you go for a grocery store, or even you come, you are at school, frequent hand washing with the soap, and make sure you mix lots of bubbles, like a half a minute or 30 seconds, basically with the water and soap. You frequently wash your hands. And if you are sick, and the best thing will be, if you are having a high temperature and you are coughing and sneezing, the best thing for you will be, you should not actually go to school, or you should not come to school. You should stay home, and once you recover, and then you should come to the school, because with coughing or sneezing, you can spread this infection to the other children also, or to the other, the students. Or if you are having a coughing or sneezing, what is the best way to prevent this infection to spread other members or other students? Basically, you cover your cough or sneeze. And how do you cover it? Exactly. You cover with your arm, like this. Once you are sick. And again, wash your hand, very frequently. And try to avoid, if somebody in the family or at school, if they are sick, basically very close contact or having, and you should also avoid it. But the best thing is, if you are having a fever, not feeling well, you are coughing or sneezing, taking a day off will be the best way. So in this way, you will not spread this infection to the other people, right? So is there any question I can answer? Yes.
What if you're sick and it happens in the middle of the day?
In the middle of the day, you are coughing and sneezing and you are having a fever also? Then it's the best thing, you should talk to your teacher, and probably your teacher will send you home. Yeah, so always talk to your teacher that you are not feeling well, okay?
Firas.
Will hand sanitizer be the same as washing your hands?
What is that?
Will hand sanitizer?
Oh, hand sanitizer, yes. Actually, the hand washing is the best thing. Okay, the hand sanitizer is the next best thing. The first thing is, the best thing is, if you have a water and soap available, and you should wash your hand for 20 to 30 seconds, like a half a minute, and makes lots of bubble in front and back and between your fingers, you wash it. The hand sanitizer has also an antibacterial. It kills most of the germs in your hands. Okay, but this may not be as good as hand washing.
Lots of kids, they go out with in the winter with light clothes or no jackets.
Yeah, this is definitely if the temperature out there is cold, you basically need to take care of proper clothing and warm clothes and things like that. Will also prevent you getting sick. Yeah. Yes.
What's the best way to reduce the temperature since once you have it at home?
Mm-hmm.
The best way to reduce it?
Yeah, the best way to how can you lower the temperature? And this is actually once Sheikh Amin was giving a lecture of Riyadus Salihin, and I was surprised. I mean, there was one hadith in Riyadus Salihin, Prophet of Islam sallallahu alaihi wasallam said, when you have a high temperature, pour water on the body. And actually when I learned this one, and I was very surprised, this is what we learn in our medical school also. When the temperature is a high temperature, basically a normal temperature, like not too cold, not too hot water, actually pouring that water on the body can lower the temperature also. Other thing is over-the-counter medications. You can also try like ibuprofen and acetaminophen or Tylenol. We should not try aspirin because the reason is the aspirin, there are certain viral infections, like if you have a flu or there are certain viral infections. If you take aspirin, there is some interaction can affect the liver of the child, and they can have a Rye syndrome. Actually, you can read about it. This can be a very serious condition. So aspirin, we should not try to avoid, try to use it in children. You can use Tylenol or ibuprofen. Sometimes the dosage on the package, over the counter, the package which you have, is not the right dose because they are very, they are afraid of, overdosing the children. So we can always go a little bit above on that. And actually, I had a sheet. If you want, I mean, it's at home. Whatever actually the right dose which you should give. The Tylenol based on the weight of the child, not the age, because it's always based on the weight of the child. And I can actually give it to Sheikh Amin, and he can make a copy of those sheets. I would recommend that sheet actually should be in every house. What should be the right dose of acetaminophen or Tylenol, and what should be the right dose of ibuprofen based on the weight of the child.
Sometimes the fever the ibuprofen would say that it goes till 5 hours, every 5 hours you
Yeah.
give it, 5 to 8 hours, but sometimes the fever would raise again even in the middle of 2 or 3 hours.
Yeah.
So should you give the ibuprofen again, or should you?
Actually, you should only try like 2 times. You can give this one ibuprofen every 4 to 6 hours. If the temperature is not significantly coming down, child is still having a fever, this child needs to be seen by a doctor. Yes. So,
Sometimes you go to the doctor and the doctor just doesn't say anything. Would you alternate with Tylenol, for example?
that's fine. You can combine ibuprofen and Tylenol together. There's no problem. Both of these medications, basically, they can lower the temperature and can have an additive effect. Ibuprofen has some additional effects because this is an anti-inflammatory, and Tylenol is not anti-inflammatory. Okay? So yes, you can actually combine these 2 medications also. At least when you take the child to the doctor, the reason is just to rule out the child is not having any life-threatening condition. Those life-threatening conditions like meningitis, encephalitis, pneumonia, and things like that. In that situation, the child needs IV antibiotics, the stronger antibiotics. So that's why if you take the child to the doctor and the doctor says, okay, this child doesn't have any life-threatening condition, and in that situation it's okay to bring the child home and treat them with the regular antipyretics or Tylenol or ibuprofen.
Jazakallah khair, Dr. Zubair. May Allah bless you.
No problem.
Thank you.
Yeah.
Takbir. Allahu Akbar.